few months back, a 30-year-old lady who non-specific pain, mid-foot sort of pain, diagnosed up at the hospital by the MSK podiatrist as plantar fasciitis. I disagreed with that diagnosis. It was deeper than that. It wasn't the plantar fascia, because she was quite a slim girl, so you could actually feel the plantar fascia, and it wasn't along that. It was deeper. She'd had an MRI scan, diagnostic ultrasound. It wasn't really showing a great deal. Now, compliance from the patient wasn't the greatest, so obviously he told, wear an air cast, rest, didn't do any of that. And first hit of laser, same thing, got back to me, it's better. So it's better, it's 20% better. So she was coming back on a weekly top up. You know, what I suspected was some sort of plantar ligament sort of strain, but her activity wasn't allowing it to rest. She wasn't prepared to rest. So her idea of a rest was a 7-mile walk. And, you know, so, but her activity was increasing all the time. So I'd be like, oh, how have things been? Oh yeah, I'm back powerlifting. Oh, brilliant. Right. How's the pain? It's gone. And, you know, after, I think that was 8 treatments, pain-free. And again, you know, like I said, I can only surmise I guess what it may have been, but, you know, it wasn't being picked up on any of the diagnostic sort of imagery that was undertaken. But you know, it was diagnosed as plantar fasciitis. I didn't diagnose that. I think it was something different. But again, it's this sort of non-specific foot pain, mid-foot pain, and it worked. So, and she's back, yeah, doing her exercise, running, powerlifting, and yeah.
And that's interesting, isn't it? Because I think that's another thing about the laser is, yes, obviously, in whatever you do, whatever modality you offer up to your patients, you've got to get the diagnosis right, haven't you? But actually, with the laser, pain is pain.
Yeah.
Yeah. When you're treating laser, pain is pain, isn't it? Even if you can't be too specific or you're not too sure what it is, you can still treat the symptom, which is pain.
Yeah. Exactly. And that's where it differs to shockwave, whereby, you know, if, you know, shock is very good, but if you have any hint that it's not, you know, if possibly is any sort of tear of any description, of course you can't, you know, you just don't, you're not going to touch it with shockwave, otherwise it could be massive issues over that. So, you know, you treat the symptom to get the pain relief, which obviously the patient will be happy about.